Stand by SOT1.
Standing.
10 seconds. Ready, rollin'. Ready, SOT1.
Ready.
In 4, 3, 2, 1. Roll in.
From legendary Uncle Studios in beautiful Southern California, welcome to another edition of Work Comp Matters, the central location for you employees, you employers, and of course, we haven't forgotten about you damn independent contractors. And now, here's this week's edition of Work Comp Matters. July 20th, 12 noon. Good afternoon, everybody. Welcome to another edition of Work Comp Matters. We are brought to you by workcompcentral.com. If you want the number one location for workers' compensation in both California and around the United States, check out workcompcentral.com. They've got a free 7-day offer. And if you want to pick up their services, I have them. You should too. It's only $1 a day. Work Comp Matters is also brought to you by A1 Law, number one computer management system, 818-357-4120 for your no strings attached money back guarantee, also $1 a day. A1 Law. My name is Steve Appell. I'm joined as usual by the madman across the water, John Scalia, and my chief of staff, who's having some technical issues, the doctor, but he's not a medical doctor.
I'm challenged.
Yeah, Mike Zyma. He's sharing my microphone today, and unfortunately, I am not courageous enough to share headphones with him. So he's not going to be able to hear what the madman is saying, but we will all be able to hear him. Los Angeles Mayor Eric Garcetti delivered a fresh warning Sunday. Oh my God, Steve, redo that. Los Angeles Mayor Eric Garcetti delivered a fresh warning Sunday during an appearance on CNN that the city was on the brink of imposing new restrictions to prevent the spread of the coronavirus. Los Angeles County public health officials on Sunday reported 2,848 newly confirmed cases. Even without Garcetti's intervention, a series of state-imposed restrictions recently took effect, including a ban on indoor restaurant dining and the closing of bars, malls, and other retailers in Los Angeles County and other counties on the state's watch list. Regarding schools, Governor Gavin Newsom announced new rules Friday that would force many of the state's districts to teach remotely when schools start next month. More than 80% of the state's population lives in counties that would currently not qualify for schools to reopen based on their surging caseloads and hospitalization rates. The rules would also require most students to wear masks in classrooms and force schools that do hold in-person classes to shut down if enough students or employees test positive for the virus. I want to go to John Scalia, who's out in Munich, Germany, and get the current status of schools and what the situation is there with schools. John?
The schools are open, and the precautions for the students are, I'm sure social distancing is being used in all of them, and probably masks. But Germany has a lot. Well, Germany doesn't have technically a federal system like Americans know, a federal system, but we have a quasi-federal system, which means that each individual state in Germany is in charge of its own state, just like America. So what's done in each school can vary from state to state. So for example, some of the states will take the temperature of the kids as they walk into the classrooms, others may not. But by and large, the schools are all open and everything is pretty much returning to normal. I can tell it even by the traffic on the street now. Whereas during the height of the pandemic, it was really sparse. Now the traffic is back to normal because my apartment fronts on a very busy street. And I can tell So yeah, our schools are pretty much back to normal with precautions.
And I don't know what's happening with the schools in New York, but I think that many portions of New York are starting into stage 4 from what I read. And Mike is shaking his head. So although he doesn't have a story prepared on New York, I'm going to allow him to comment on that and maybe talk about his current thoughts about the school systems in Los Angeles County. Mike?
Yeah, my understanding is that New York is entering into phase 4. They're still having some problems with some rogue group of folks not masking and such. I don't know whether it's going to hold them back from going into stage 4, but I think that Cuomo, frankly, is a rock star in all this. In some ways, I wish he was taking the place of Biden. But with regard to LA schools, my understanding is that they're going to open up virtually and then see how it goes. And that is what is happening with the William S. Hart Union School District in Santa Clarita, too.
And I know Mike has a story on that, but I want to go to John Scalia first. He's got a news story. And then, John, if you want to do a segment, we can do that in the second half of the show. So go ahead with your first news story of the day.
Okay, feds to send COVID tests to nursing homes, but can California really use them? This is from the LA Times, July 15th. State health officials were caught off guard by the federal government's plan, as the tests are less accurate and may be of limited use in California's nursing homes. 6 months into the coronavirus pandemic, the federal government this week announced it would send COVID-19 rapid testing kits to the nation's more than 15,000 skilled nursing facilities, starting as early as next week. But the kits may be of limited use in California because the state's public health agency currently requires nursing homes to use more sensitive tests than the federal kits offer. That disconnect between what federal officials offer and what California nursing homes actually need right now is the latest example of what many critics have characterized as a top-down, disastrous federal response hampered by lack of communication with states. Other states requiring monthly or weekly COVID-19 testing in nursing homes, including Connecticut, New Jersey, New York, Massachusetts, and Pennsylvania, may face the same problem. I'm concerned about the way the federal government has seemed to do things without actually engaging the folks who understand how things work in nursing homes. Mike Wasserman, president of the California Association of Long-Term Care Medicine. California public health officials were caught off guard by the announcement, as were those in other states. They had no answers this week for nursing home administrators who asked if they could use the new testing kits for surveillance testing. The California Department of Public Health on Friday told Cal Matters in an emailed statement that it was aware of the federal test kits, but sidestepped the question of whether it would change its rules so that nursing homes could use the type of tests in the federal kits. The kits, which include a tabletop testing machine and materials for 400 initial tests, use antigen tests designed to screen for disease rather than conclusively diagnose it. A machine can run as many as 20 tests in an hour, and each test after the first free 400 tests would cost the home about $25. The antigen tests look for proteins from the virus rather than molecular diagnostic tests that detect the virus genetic material. Antigen tests are faster and cheaper, but less reliable than the more sensitive diagnostic tests, which can range from 100 to 150 per test. Although the diagnostic tests now are more available than they were earlier in the pandemic, some nursing homes have reported difficulties obtaining reagents and other testing supplies. In late May, the California Department of Public Health ordered the state's 1,224 skilled nursing facilities to conduct baseline COVID-19 testing of every resident and worker in June, and then continue regular surveillance testing after that. The goal, to eliminate the devastating outbreaks that to date have sickened more than 16,000 elderly or medically frail residents and killed nearly 2,900. About 81% of nursing homes have completed their baseline testing as of this week, according to a Cal Matters analysis. Nursing homes must use tests that offer at least 95% sensitivity, meaning that the test can't miss more than 5% of the people that have the disease. Okay.
John, thank you very much for that complete story. And now with his first story, the technically challenged doctor, but he's not a medical doctor, Mike Zyma.
Thank you. Thank you so much, boys and girls. Every once in a while, I like to read a story from the Newhall Signal. I'm sure John knows a lot about the Newhall Signal. They've had a couple of stories that are just, in my opinion, right there, okay? This is a story that ran on Friday, and it's a problem, I believe, that we're having in LA County, and they hit it right on the head. It's by Tammy Murga. Los Angeles County Health Officer Muntu Davis said Thursday the Department of Public Health responds to 2,000 to 3,000 complaints per week over businesses not complying with COVID-19 safety measures, with face coverings among the most common. Quote, "We're not seeing the compliance that we need with the public health directives in place to keep people's health and livelihoods safe," end quote, Davis said during a virtual media briefing. The department's inspectors have worked 7 days a week conducting unannounced site visits in response to high volume complaints that officials receive via phone, web, or email, he said. Face masks in public are mandatory countywide and across California, but the matter has become the center of conflicts involving customers refusing to wear them or employees not wearing them properly in the workplace. Quote, "Among the most common compliance issues our inspectors encounter when they go out are an inconsistent and improper use of face coverings. This can include wearing a face covering just below the nose, wearing them below the chin," end quote, Davis said, adding that they must cover both the nose and mouth. Quote, "It's one of our most effective strategies that we have to prevent transmission," end quote. Across 52 investigations at restaurants, health inspectors have found that the most common non-compliance issues among employees include a lack of physical distancing in the kitchen area among employees, infection protocols are not shared with workers and customers, and that employers are unaware of requirements to quarantine employees who are close contacts of those who test positive. Among employees, the most common issue was not reporting symptoms or illness. In 47 grocery store investigations and 23 at wholesale food manufacturing sites, the most common issues among employers included not sanitizing high-touch surfaces, failing to regularly monitor the maximum capacity of stores to prevent overcrowding, and not posting infographics and signage for patrons. Employees also failed to report symptoms and to physically distance in break rooms. When it comes to enforcement, Davis said the worst case scenario is the issuance of fines or having to close down a business over repeated violations. He said, quote, "It's very rare that we have to go to that level, but it's always an option on the table," end quote. With a high volume of complaints, he added that public health officials have been in conversation with the state about assistance in providing oversight and regulatory authority. In Santa Clarita, public health had received more than 90 complaints in May about businesses defying safety measures, many of which involved face coverings. Complaints were attributed to smoke and vape shops, barbershops, car washes, and food vendors without permits.
Smoke and vape shops. I thought that they were closed. My goodness. And by the way, speaking of markets and stuff like that, I've got a story coming up right like in a moment about Whole Foods Market. And then after I read that, John will have another story and or his take. My name's Steve Appell. You're dialed into Work Comp Matters. We are brought to you by the workcompcentral.com. If you want the #1 location for workers' compensation in both California and around the United States, check out the workcompcentral.com. They've got a free 7-day offer. And if you want to pick up their services, I have them. You should too. It's only $1 a day. Work Comp Matters is also brought to you by A1 Law, #1 computer management system. 818-357-4120 for your no strings attached money back guarantee, $1 a day. A1 Law. Whole Foods Market Inc. Strike that. Whole Foods Market Inc. has been sued by employees who accused the upscale grocery retailer of disciplining and retaliating against workers who wear Black Lives Matters face masks on the job, including one who said she was fired. The proposed nationwide class action accused Whole Foods, a unit of Amazon.com, of sending employees home without pay or threatening to fire them for wearing the masks on the grounds it violates the company's dress code, even as it let workers conveying other messages continuing to do so. And now I'm going to go to the madman across the water, Mr. John Scalia, who's got another story and maybe a take. John?
San Diego County businesses defy second shutdown order. County strike force mobilizes. Sean Gilbert is not shutting down, not again, after losing tens of thousands of dollars during the first government-mandated closure of his University Heights gym, Boulevard Fitness. Not even after getting a visit Thursday from 2 San Diego police officers who were checking out his facility after reports that Gilbert had stayed open against state and county orders. Gilbert, the son of Irish and Italian immigrants and blue-collar workers in Boston, said he's been working toward small business ownership since he was a teenager. At 18, he began working in low-level gym jobs, peppering his bosses with questions about how they made their business successful. Now, 25 years under his belt in the fitness industry, he's at his limit with Governor Gavin Newsom's latest order to shut down gyms again barely a month after he reopened. If I closed again, there's a possibility I'd have to close these doors forever, and I'm not going to let that happen, Gilbert said. I've worked nonstop, taking virtually no sick days to build something up from nothing. I won't let it get destroyed. Boulevard Fitness remained open Thursday, even though San Diego County ordered all gyms, salons, and other personal services to close as of midnight on Tuesday. Gilbert is not alone in that decision. At least 2 gyms in North San Diego County also remained open: Metroflex Gym in Oceanside and the Gym Vista. The owner of the former, Lou Uridel, became a bit of a local celebrity after he was arrested in May by Oceanside police for reopening his gym against the county's health order. Uridel was released the same day and has a court hearing scheduled for September. All these businesses and others, from salons to churches, pushed back against county and state regulations meant to slow the spread of COVID-19. Some are questioning whether the county's education approach to enforcement is working. Although county officials have ordered a handful of businesses to close, they have largely relied on community members and businesses to adhere to a sort of honor system. An honor system some businesses feel is built on faulty regulations that unfairly impact some more than others. I'll stop there. I mean, what I say is, you've got a president of the United States who refuses essentially to wear a mask, okay? And he holds press conferences without his mask. He's just said now that he's going to back to his daily press briefings because he can't stay away from the telly. But, it's going to be interesting.
And I thank you for that, John. On to Oakland, California. Oakland will pay $32.7 million to settle lawsuits filed over a 2016 fire at an illegally converted warehouse dubbed the Ghost Ship that killed 36 people, the city announced last week. The city council authorized settlements of lawsuits filed by the families of 32 victims. The amount also included more than $9 million for Sam Maxwell, who survived the blaze but will live with severe lifelong injuries and major medical expenses, a city statement said.
Smoke from a wildfire in Fresno County continued to drift into the Bay Area on Sunday, prompting the extension of an air quality advisory through the weekend. Smoky and hazy skies are likely across the region due to the mineral fire burning about 160 miles to the southeast of San Francisco, according to the Bay Area Quality Management District, which extended its air quality advisory through Sunday. And now that's just what we need. We're entering fire season. Here we go.
I have a question. I don't know much about meteorology, virtually nothing, but is that the normal way the winds blow from south to north?
John wants to know if that's the normal way the winds blow from south to north. I didn't know there was a normal way that the winds blow. Mike?
That is a very good point. This would mean that the winds are blowing to the northwest, which is very strange because it usually comes in right from the ocean going east.
That's what I thought.
And if I could hold a tune, I would sing Blowing in the Wind by Bob Dylan, but I can't hold a tune. On to Las Vegas. A federal judge has dismissed a lawsuit filed by 9 women who allege they were sexually harassed by former casino mogul Steve Wynn. I didn't know he was a former casino mogul. I thought he was
current.
Yeah, I thought he was the current mogul. Yeah. The women, manicurists and makeup artists, in a salon at the Wynn Las Vegas were unnamed in the lawsuit and instead identified by their attorneys as Judy Doe number 1 through Judy Doe number 9. I thought those were originally Jane Does, but I guess now in the Wynn case, they're Judy. Their decision to stay anonymous was one reason the judge dismissed the case. In a Wednesday filing, argued they hadn't legally justified to the need to stay anonymous to continue their case. John, did you have a segment or another news story?
Actually, I don't have either.
Oh, okay. Well, then we're going to go ahead to the doctor. And Mike, here's another news story.
Alarmed that unlicensed cannabis sellers continue to dominate California's pot market, state lawmakers are moving toward imposing steep new fines on businesses that provide building space, advertising platforms, and other aid to illicit operations. Those who provide assistance to illegal pot sellers would face civil fines of up to $30,000 per day under legislation approved unanimously by the state assembly that is now pending in the Senate. A final vote on the proposal is expected sometime after lawmakers return to Sacramento this month.
Wow, that's a stricter penalty than you used to get for actually smoking the stuff when it was illegal, isn't it?
Yeah, John is saying that's a stricter penalty than you used to get fined when it was illegal and you were found smoking this stuff. Well, they used to throw you in jail for that, didn't they, John?
Well, yeah, a long time ago it was a felony, actually, but that was a while back. Then it became an infraction.
And I remember when marijuana first became legal recreationally, I believe it was 2 years ago, last year, it was going to be the eventual savior of all of our money woes, and it was going to generate all of these tax dollars. And there have just been places that have been closing down. People aren't reporting things. A lot of the companies that applied for licenses and open businesses apparently are going out of business. But there are still a lot of people that are in business. We have about one story left, and then we are going to go on this challenging, technologically challenged edition of Work Comp Matters. Finding a toilet became more difficult for Sacramento's homeless population. That's story 22, Mike. During the corona pandemic, as gas stations and fast food joints, speaking of marijuana, close their restrooms. Boy, am I tongue-in-cheek today or what? Close their restrooms and public facilities periodically, shuttered in an effort. There's that word shuttered again. Remember we were talking about shuttered last week? Shuttered in an effort to rein in the outbreak. The pandemic compounded existing issues for Sacramento's homeless population, which has long struggled to access toilets and sinks.
Steve,
Yes, sir. Go ahead, please, sir. Go ahead.
Yeah. On one of your prior programs, remember you had the marijuana lawyer, whatever her name was.
Yes, that would be go ahead, John. Yes, I do remember.
Okay. And her point seemed to me was that the regulations and the restrictions regarding getting into the marijuana business were going to stifle it. I mean, she was pointing out because of the federal government's recalcitrance to go along with the states, the feds have made it like impossible for the people who own those things to get bank accounts, et cetera, et cetera. So it doesn't strike me as particularly surprising that with all these difficulties and restrictions that you're going to have the marijuana stores going out of business. Plus, I believe she also said they were going to have trouble getting like normal business insurance too, right?
She basically said that if you are not well-funded, well-connected, and well-organized, don't even think about trying to apply for a license, nevertheless opening the business and staying in business. That is correct.
And that goes against basically all the small business models in America, right? Because if you were to use those requirements to open a small business, most of them wouldn't be able to open, right?
I was going to say they would never open because correct. Yeah. That's like opening a corporation. I mean, she didn't specifically say it, but I interpreted that if you don't have a couple of $1 million ready to go, forget it.
Yeah, I agree.
Absolutely.
And now we're seeing the effects of that policy. The feds are getting their wish.
Yeah, exactly correct. I want to thank you, John Scalia, for joining us once again. Much thanks to the technically challenged Chief of Staff, Dr. Mike Zima, sharing my microphone, but in no way, shape, or form are you going to let him share my headphones. And Scott Walton of Uncle's Studios, and all the good people back at the Work Comp Central and A1 Law. My name is Steve Appell. We'll see you again tomorrow at noon for another edition of Work Comp Matters.